Well, for me, going beyond is really not a difficult matter. I've been fortunate to have learned a skill that is really worldwide in nature, and it's very easy for me to work with people. There's a language barrier in El Salvador, and I don't speak Spanish, but nonetheless, it's easy to relate to people. Several years ago, I listened to a lecture by Joe Bowles who talked about the program in El Salvador, and I indicated to him that I'd like to go. Years went by. They were in the middle of a civil war, and I wasn't really anxious to go at that time. A nurse who was a pediatric nurse, Ginger, and my wife had talked about this, and I came home one day, and they were both sitting on the front porch and looked at me and said, "We're going to El Salvador." And I said, "Fine, I've been wanting to go for years." The poor Salvadorans that we serve are mostly from rural areas, and rural incomes are very, very low because they mainly are coffee bean pickers and farmers. They can't afford to have even the most minimal medical care. Many of them have cataracts that just get so severe that people are literally blinded by them. Once the cataracts are removed, their life changes immediately, and you can see it on their face the next day. It's just really exciting. I'm wearing this t-shirt, which is the color and the logo of the Salvadoran association called ASAPROSAR, which stands for Salvadoran Association for the Rural Healthcare. The reason it's so bright yellow and orange color is that it was used during the Civil War. And it was actually protection. Both sides of the fighting, warring parties were advised that those people wearing this t-shirt are like the Red Cross. There are so many people in need, not just in developing countries, but just down the street in neighboring communities. And there's so much capability that we have. Our community is full of people that are very intelligent and have all sorts of skills that can be passed on very easily. And so it's so easy to just take a little bit of your spare time and to find a place that needs what you have to offer. And it's so easy from there. It just grows by itself. Well, I'm very honored to receive this honor and this recognition. And my first reaction was, that's terrific. I'm glad that there's a program that I'm being honored at. And then it occurred to me that what I'm doing is part of me, and it's not really that special or that great. And there's so many people out there right now that are in this audience that provide so many hours of volunteerism and do so many good things that, you know, I'm humbled and I'm honored and I'm delighted to be here.